All right, the Centers for Disease Control out with some recommendations when it comes to the hepatitis B vaccine. Joining us now to discuss, Dr. Nancy Reau. She is Chief of Hepatology at Rush University Medical Center. Dr. Reau, thank you for being on the program. We appreciate it.
Thank you so much for inviting me.
Okay, so there was some talk that RFK Jr. was going to have a vote on possibly delaying the first administration of this vaccine to infants. I understand that's now up in the air. It's probably not going to happen. We kind of sort through this for us and tell us what should happen when it comes to this, getting this vaccination at birth.
Yeah, so I think the timing of things can be a little bit arbitrary. However, it's important to recognize that globally, hepatitis B that leads to chronic infection, which increases cancer and cirrhosis rates, occurs in early childhood at the time that you're born. And so if we want to decrease the long-term consequences of Hep B, we need to really prevent childhood infection as opposed to concentrating on at-risk behaviors. I don't think it's necessarily magical that the first dose occurs at birth, but disrupting the standard vaccine schedule is always going to mean that children get missed. And then lots of children, unfortunately, even in the United States, do not get the appropriate pediatric care that they should. And so you decrease again the opportunity to allow children that could be at risk to be protected. That is a 3-dose vaccine. So remember, if you want to be fully protected from hepatitis B as a child, you need to start that first dose and then have 2 others. Only one vaccine decreases the risk of getting chronic infection by 50%. So even that birth dose vaccine doesn't fully protect these children. But that second vaccine at 1 month, because many children do get their 1-month pediatric appointments, really then increases the chance that they could be protected for their lifetime to over 70%. So that third dose really is the one that seals the deal, leading to almost near universal protection from hepatitis B.
Okay, I guess the burning question for a lot of people would be, are there risks for those infants? Are there risks at all for getting that first dose at birth?
Right. We never say anything is risk-free, but in the world, millions and millions of children have received hepatitis B vaccination, and we do not see significant consequences from this vaccine.
Okay. In terms of the effectiveness, you mentioned 70%. What does that mean in real terms? How successful would you say that the U.S. program has been in reducing hepatitis B infections among the youngest Americans?
Right. It's over 90% effective if you have all 3 vaccines. And that, I think when we talk about consequences, prior to universal vaccination at birth, there were about 20,000 children in the United States that got chronic hepatitis B infection. And that's now minimal. If you look at charts that look at people born in the United States, the risk of hepatitis B is tiny. And although, hepatitis B consequences are small in the United States, we don't have a lot of individuals that are born here that end up with a chronic infection. But you have to remember that it's not just, that acute infection. It's also risk of things later on in life, like reactivation if you have chemotherapy, or long-term cancer risk. Well, hepatitis B vaccination was the first anti-cancer vaccine because hepatitis B is a sneaky virus. It inserts itself into the person's, the host's genetics, and that really removes targets or messages that prevent liver cells from going into cancer mode.
Dr. Nancy Reau with Rush, thank you so much for clarifying some of these burning questions that are on the minds of a lot of us as we see things kind of change on the CDC level. We appreciate your time this morning.
Thank you very much. Thanks for inviting me.